suturing armamentarium. So out of suturing armamentarium, I have already discussed the suture materials. So there are few instruments that we use during the suturing process, and I'm going to discuss those instruments first, and then we will talk about the suture needles separately, because that is a topic in itself. So let's see what are the suturing armamentarium that you are going to need if you are going to practice the suturing. So suturing is not exclusive to oral surgeons. So even if you are a general practitioner, any kind of situation where you are extracting the tooth, maybe the bleeding is there, maybe the extraction socket is way too much, or maybe you have extracted a very difficult tooth, maybe a root stump or something, it is important that you put sutures there, because sutures, as I have already told you, they offer you a lot of advantages. Suppose if you are doing multiple extractions in a patient, like 4 or 5 extraction in a single quadrant, what you can do is, after debridement, after curettage, you can just put the sutures and the wounds will heal beautifully. You don't have to extract one tooth at a time and then call the patient again and again, putting them into trauma and giving them a lot of medications. Just put them on medications first once, and then just extract the tooth, 4 or 5 teeth at once, after taking care of their medical conditions, and just put sutures. I'll show you techniques where you can give continuous suture or maybe interrupted suture in different extraction areas. So sutures are very important skill. Suturing is very important skill for all the dentists out there. So here comes the suturing armamentarium. So first of all, we need the needle holder. That is the first most tool of suturing if we want to do it. So there are various type of needle holders which are available in the market, and there are sizes available. So according to your own convenience and preference, at least keep 2 or 3 needle holders in your practice. I personally like one long needle holder, because in some patients, it's very difficult to reach certain areas, so I'll be needing a longer needle holder, and in some cases I'll be needing this smaller one, and I keep this one also, and I have few 3 or 4 longer needle holders also. So what does it look like? This is how it looks like. It can be a little longer also. This is the basic body of the needle holder, and this is where it holds the needle, and these are the placements for your fingers, and this is the latch. And when you hold the needle holder, I have made a separate video how to hold a needle holder and how to take out the thread and how to start suturing. So I will not explain everything in detail here. Just look at how does it look like whenever you go to the expo or any other place where you buy your instruments. Look for 2 or 3 type of needle holder. Few things that you need to check before buying a needle holder is this joint area should be very smooth. Sometimes they do not use good quality metal, and that joint area is very hard and it doesn't open and close beautifully, and sometimes there are sharp margins here. There are sharp margins, so whenever you are suturing, threads get stuck over here, it doesn't come out and it breaks. So buy a good quality needle holder, because when low qualities, they leave the needles in between, they break the threads and thread gets stuck, and it's very frustrating. And second point that you need to check is this latch point. Sometimes the quality is not so good and these latches are not effective. So if you try to close, it doesn't get closed. So check the lock as well as check the this connection area also, so that you get the good quality. Then how to hold a needle holder. This is me holding a needle holder in front of you. This is how I preferably hold it. There is one other method to hold the needle holder, and it is absolutely up to you how do you want to hold it. There are theoretically 2 methods, scissors grip and the palm grip. I personally prefer this, and my thumb is supporting. My thumb is into the one hole, this finger is into the other hole, and my index finger is basically supporting the hole of the needle holder, so that my index finger guides my tip of the needle holder where to go and how to pierce the needle into the tissues. So I am holding it, this is my guiding finger, this is guiding needle. Okay, you have to go into this direction and pierce the tissues. So I have shown in the video also, you can go through it, and whatever grip is okay with you, you can choose that. And this is how a palm grip looks like. See, I have mostly learned my surgical techniques using the scissors grip. That is again up to you. You can read the little bit of the text here that I have written about this technique, and this is how the palm technique looks like. Again, the scissors. So scissors, there are a lot of scissors available in the market. I would suggest buy one small and at least one curved scissors. One small scissors, because at times the sutures are very closely approximated to the gingiva, and when you try to cut the suture, you can cut the it's very close. You have to be very careful. If your scissors are very big, they're going to injure the gingiva. So the tip of the suture cutting scissors has to be very, very small and sharp also, so that you go under the suture without injuring the gingiva and just cut it. And I like to keep few curved scissors also, because of the curvature I can reach up to the difficult access areas like third molar areas, second molar areas, and the areas where I need to what I do, if there is a suture here, and I slide this tip below the gums and gently lift my suture and just cut it. So I use this curved suture scissors a lot. Again, how to hold the scissors, palm grip and the scissors grip, and you can practice what kind of grip you prefer. Third armamentarium that we need is tooth tissue forceps. Some people say it is optional, but I don't think it is optional. I find it is absolutely mandatory that you use tooth tissue forceps. So what exactly are they? These are the straight tissue forceps. This is the example of a straight tissue forceps, and you see this is exactly straight. There is nothing over here. These tips are blunt. But if you look at this forceps, you can see a tooth-like projection here, a tooth-like projection here. The purpose of this tooth tissue forceps is to hold the gingiva or hold the tissue while we are passing the needle through it. If we are not holding the tissue with the help of the tissue forceps, what happens is tissue keeps on running here and there, because it's a cut tissue, it's not stable tissue. Especially in the cases where you have given vertical releasing incisions. Suppose if you are given envelope flap and there is no vertical releasing incision, still you can work your way with non-tooth forceps. But if you are given two releasing incisions, one in the anterior, one in the posterior, then the flap is actually very loose. You cannot manipulate or cannot handle the flap without the help of the tooth tissue forceps. You hold the flap with the help of this tissue forceps and then pierce the needle through it, and then through the other flap, and then do the suturing. So it is for the picking up of the suturing needle. And it has another advantage also. Suppose if you are going from one direction, point A to point B, in the suturing, and with the help of the tooth tissue forceps, you have already gained access into the one flap, and once you are entering into the second flap, the needle comes out, and then since the needle holder is grasping the needle, so how will you grasp the coming end of the needle? So if if in my other hand the tissue forceps is there, so I usually grasp the other end of the needle with the help of the tissue forceps and take my needle out of the tissues from the second flap. So this is another use of tissue forceps. So this is very, very important tool as far as my practice is concerned, my own surgical practice is concerned. So keep at least 1 or 2 tissue forceps in your practice, in your armamentarium. This is a very fine tooth tissue forceps. I use it for closure of the skin wounds where I need to give some very fine sutures like 5-0 or 6-0 types, we have to hold the skin in a very light fashion. But in oral cavity, you can keep this kind of tooth tissue forceps and it will be sufficient. So this is everything about suturing armamentarium. I am going to discuss suture needles separately in a different video because that is a topic in itself. So let's see you with the presentation of suture needles.